Senate Bill 1570, having received the constitutional majority, is declared passed.
Senate Bill 1570, also known as the Healthcare Without Fear Act, would create clear boundaries revolving around when hospitals can share personal information related to immigration or citizenship status.
It adopts written policies on how to interact with law enforcement if the law enforcement were to enter a hospital or healthcare facility. And it just also identifies like who is the main person, who are the main people who are going to be responding to a situation like that when it comes to healthcare workers.
One case that instantly came to mind for Representative Ricky Ruiz was that of the Crespo Gonzalez family, who were detained for weeks with their child while taking her to Adventist Health.
They were seeking emergency medical care for their 7-year-old daughter, and it gets swooped up by 3 unmarked vehicles. I think this is all in response to several cases across the state of Oregon that we've seen federal enforcement agents dropping off patients or roaming around the hospitals and honestly creating an unsafe environment for patients and people who are seeking medical care.
2 people were also shot by a U.S. Border Patrol agent in January in the parking lot of Adventist Health Primary Care, although they were said to be Venezuelan gang members by the Department of Homeland Security. Ruiz says he's felt this bill was needed for a while.
For me, it was right after President Trump removed the safe spaces, and there was no question that we had predicted we're going to see federal law enforcement in near schools, near hospitals, near churches, near areas that are supposed to be protected.
The bill also requiring protections for healthcare workers who protect patients.
Having protections in place is reassuring. It provides also some feelings of safety and also feelings of empowerment that, I can provide education to my patients on their constitutional rights.
Christian Mendoza Ruvalcaba is a part of the Oregon Nurses Association.
Fear of immigration is, already occurring in our communities. Having this in place also makes the community members feel more secure to come to the hospitals.
And while there would be exceptions for immigration enforcement, it would be limited.
If there is no specific reason for why federal agents are seeking information of patients who are in a hospital or a healthcare facility, then we should be able to have rules and regulations on ensuring we're protecting that information.
KGW reached out to Republicans for comment Wednesday on the bill, but no one was available to speak. The bill now goes to Governor Tina Kotek's desk.
Hospitals are meant to be safe places to receive care. They're not meant to be places of immigration enforcement.
In Salem, Celine Stevens, KGW News.